An artificial insemination program is an investment in the future of your herd, and there are three basic elements in learning to be successful in artificially inseminating cattle. They are having the mental commitment to learn, acquiring the basic skills, and gaining competence through repetition. Although artificial insemination is a manipulative skill, learning to do it requires concentration and mental commitment. Understand that learning the process may take longer than expected, since it requires entirely new manual and perceptual skills. You can learn more quickly and confidently if you are given the basic skills for completing the task. While there is a great deal of variation between cows, learning the basic skills provides you with a step-by-step procedure to follow. The final element in learning to AI cattle is to repeat the procedure over and over in a variety of cows. Through repetition, you make the procedure your own and learn to adjust your procedure to be effective on every cow. This video will cover the basic female anatomy, artificial insemination technique, and tips to get the most out of your AI program. While artificial insemination is principally performing manual skills, familiarity with the reproductive anatomy of the cow is essential. The ideal training situation is to work with an excised reproductive system so you can familiarize yourself with the appearance, size, and feel of the various parts of the cow's reproductive system. With that in mind, this video is not intended to serve as an artificial insemination training program, but as a training aid to be used in conjunction with a training program. It may also be used as a refresher for people who already know how to AI, but simply want to brush up on their skills. In the next couple of minutes, we will discuss the names and locations of the female reproductive organs. Keep in mind there's a great deal of variation among cows and the relative size and location of the reproductive organs. The challenge is being able to recognize these differences and knowing how to successfully adjust to them. While not part of the reproductive tract of the cow, the rectum plays a vital role in the act of artificial insemination. The rectum is the posterior end of the large intestine. When there is an accumulation of feces in the rectum, forceful contractions of the muscle layers of the gut move in waves toward the anus and move the feces posteriorly. These contractions are called peristaltic contractions. In response to the peristaltic contractions and feces in the rectum, the anus opens reflexively to eliminate feces from the body. The vulva represents the external opening of the cow's reproductive tract and is situated directly below the anus. At the bottom of the vulva lips is a small mound of erectile tissue called the clitoris. The vulva opens into the vestibule, which extends anterior where it joins continuously with the vagina. In the floor of the vestibule, at its junction with the vagina, is a longitudinal slit. This slit opens into a blind pouch called the suburethral diverticulum and is located just below the opening of the urethra. The urethra runs forward below the vagina to the bladder. The vagina is a thin-walled, elastic, tubule structure continuous with the vulva vestibule. The very tough, elastic walls of the vagina are characterized by the longitudinal folds, which provide for great stretching during mating and when a calf is being born. Cells in the vaginal wall, particularly closest to the cervix, secrete mucus, which lubricates the organs during mating and calving. At the anterior end, the cervix protrudes into the vagina. Because of its thick, fibrous walls, it is easily distinguished by palpation, feeling like a piece of rubber hose. Numerous thick folds protrude into the cervical lumen, forming a series of tight rings of tissue. This narrow passage forms an obtrusive barrier between the vagina and the uterus. During estrus, there is copious mucus flow from the cervix. The uterus of the cow consists of two horns and a body. The whole organ is attached to the pelvic and abdominal walls by the broad ligament of the uterus. The uterine body of the cow is very small, averaging 5/8 inches or 2 centimeters long. The uterine body is only the small area between the anterior end of the cervix and the internal uterine bifurcation. In younger, non-pregnant cows, each uterine horn extends anteriorly and curves downward into the pelvic cavity. In older cows, the horns may extend down into the abdominal cavity. Contractions of the muscle layers of the uterus facilitate transport of the spermatozoa after insemination. Each uterine horn narrows at its anterior tip and enters a small, twisting, and convoluted tubule called the oviduct. At its anterior-most end, the oviduct opens up into the funnel-shaped infundibulum, which surrounds the ovary and acts as a catcher's mitt. It catches the freshly ovulated ova or egg and funnels it into the oviduct. When cows are inseminated, sperm travel through the uterus and up into the oviducts to populate or colonize the upper third of the oviduct. The ovaries are almond-shaped structures located at the anterior end of the oviducts. The ovaries are responsible for ova or egg production. As the female gonad, each ovary contains many thousands of eggs at the time of birth. Only a small fraction of these are used throughout the reproductive life of most cows. The right ovary has been shown to be more active than the left, with about 60% of ovulations occurring from the right ovary. Each ovum is enclosed in a fluid-filled ovarian follicle. This fluid-filled structure resembles a blister. When the follicle reaches its full size, the surface wall thins and ruptures, releasing the ovum from the follicle. This process is called ovulation. The ovum is picked up by the infundibulum and travels down the oviduct where fertilization occurs. After ovulation, the cavity left on the ovary fills in with a spongy to firm, yellow-colored tissue called the corpus luteum, or yellow body. The corpus luteum reaches its maximum size about 10 days after ovulation. At about 14 to 15 days, it begins to shrink or regress. In addition to producing the ova, the ovaries produce the hormones which influence the reproductive status of the cow by regulating the reproductive cycle and secondary sexual characteristics. Now that you have a good understanding of the reproductive tract in the cow and what each reproductive organ does and feels like, let's move on to insemination technique. The procedure used for artificially inseminating cows is called the rectovaginal technique, where one hand is placed in the cow's rectum to locate and manipulate the reproductive organs and facilitate passing the insemination gun through the vagina and cervix for depositing of semen into the uterine body. You can use either hand inside the cow. A few people have learned the procedure using both hands. Most people are trained to hold their insemination gun in their right hand and place their left hand in the cow to manipulate the reproductive organ. Ultimately, it is your choice. The GENEX procedure for learning the insemination technique has 8 steps. They are getting ready, preparing the cow, freeing the gun, entering the cervix, passing through the cervix, positioning, depositing the semen, and withdrawal. Now it's time to learn what each step entails. If you are going to breed cows, your fingernails should be clipped and any obtrusive jewelry and watches should be removed. Wear clothing appropriate to a job that can get dirty. Essential to effective and efficient insemination is having all the necessary equipment and supplies ready and at hand when you are preparing to breed a cow. Your breeding equipment and supplies should be kept clean and available in a breeding kit. Once you have selected and prepared the semen according to proper semen handling procedures, the prepared insemination gun should be placed inside your clothing or gun warmer to protect it from sudden temperature changes. Place some paper toweling in your right pocket so you can reach them with your free hand when breeding the cow. You are now ready to put on your breeding glove and lubricate your hand and arm. When your glove is lubricated and your insemination gun is inside your clothing or gun warmer, you are ready to breed the cow. As you approach the cow, talk softly to her so she is aware of your presence. While cows have a very wide field of vision, they do have a blind spot directly behind them and can be startled if you just walk up behind them and grab their tail. Once the cow is aware of your presence, touch her to let her know you are standing directly behind her and grasp the tail about a third of the way down from the tail head and hold to the side. This exposes the rectum and makes it easier to remove excess manure. With your gloved hand, wipe a small amount of the lubricant around the anus. Then, cupping your hand and forming a cone with your fingers, place the tips of your fingers in the anus. Using a twisting motion with the fingers, gently force your fingertips in through the anal sphincter. The anal sphincter will relax and you will be able to slide your entire hand and forearm into the rectum. Once your hand is inside the rectum, you will likely encounter large amounts of manure, which should be removed before attempting to service the cow. To remove the manure, reach forward in the rectum and cupping your hand, pull back, forcing the manure out alongside your arm. It is not necessary nor recommended to remove your hand from the rectum to accomplish this cleaning. Removing your hand permits air to flow into the rectum, which can create unnecessary problems. After the manure has been removed, you will be able to feel the reproductive organs through the wall of the rectum. Next, gently push down and begin sweeping from side to side. This sweeping motion will help you realize the extent of the pelvic cavity. As you continue the sweeping motion, press your fingertips down toward the anterior edge of the pelvic floor. The most common location of the cervix is at the anterior edge of the pelvic floor. If you do not feel the cervix in this position, continue your sweeping motion, first sweeping back and then forward of the pelvic brim until the cervix is located. When you have located the cervix, you will feel its thickness and length. This will help in your technique to pass the gun through the cervix. Remove the paper towel from your pocket and wipe off any manure that may have gotten on the vulva or the bottom of your sleeve. At this time, some people choose to use a V-spreader to help spread the vulva lips and assist in control of contamination of the insemination gun. A V-spreader is a piece of paper towel that is folded several times and placed between the lips of the vulva. An alternative to using a V-spreader is to bring the hand in the rectum back close to the anus and then form a fist and press down slightly. This action will cause the lips of the vulva to spread, permitting easier and cleaner access to the vagina. Remove your insemination gun from your clothing and place it in the opening of the vulva with the tip of the gun pointing upward. As you pass the gun into the vagina, make a large arc with the tip of your gun, moving forward at the same time. You start with the tip up to avoid getting it caught in the suburethral diverticulum or the urethra. In many cows, a long, smooth arch will bring you into the anterior portion of the vagina, right at the os cervix or cervical opening. On most cows, 2/3 to 3/4 of the entire length of the gun will be inside the cow. If the gun has not gone in far enough to reach the cervix, you are likely caught in a fold or wrinkle in the vaginal wall. To remove your gun from the fold, you must either take your fingertips and try to smooth out the wrinkle or grasp the cervix and push it anteriorly to remove the wrinkles, permitting the gun to travel the rest of the distance to the cervix. It is not necessary to hold the cervix while you are trying to pass the gun through the vagina. This usually results in folds and twists in the vagina, which can exasperate your efforts in getting to the end of the cervix. It is extremely important that once you have begun your insemination procedure, you do not remove your gun from the cow until you have completed the process. If the gun is removed, it will become contaminated upon removal and should not be put back in the tract. Cold shock of the semen may also occur. Once the tip of the insemination gun is in the anterior end of the vagina at the os cervix, you are ready to start your gun into the cervix. Place your thumb alongside the posterior end of the cervix and slide your hand underneath the cervix until it is cradled in the palm of your hand. Hold the cervix with your thumb and first 2 fingers. Push the cervix forward to eliminate the vaginal folds around the os cervix. Hold the gun with a gentle forward pressure and manipulate the cervix until it fits on the end of the gun. Make sure you are holding the cervix as close to the posterior end as you can. Grasping too far forward on the cervix will cause the posterior end of the cervix to droop down, making it nearly impossible to get the gun in the opening. Starting the gun into the cervix is often the most difficult part of inseminating cattle, and the step that gives beginners the most difficulty. It can be difficult to know for certain if you are in the cervix or caught in a fold in the os cervix. If caught in the os cervix, you may feel the grittiness of the folds of the cervix, but will be unable to advance your gun forward. Some tips for getting the gun started into the cervix are to use your thumb to find the opening, and then slide the gun up to your thumb. Move your thumb out of the way, and the tip of your gun should be lined up with the opening to the cervix. You can also squeeze the posterior end of the cervix lightly to help close off any folds and blind pockets around the cervix. This will make the opening to the cervix more prominent and lessen the chances of getting caught in a fold. When entering the cervix, think of it as putting the cervix over the gun, not pushing the gun into the cervix. You can try to muscle your way in, but you will only get frustrated. Use finesse and you will be much more successful. Once the gun is entered into the cervical os, it can be held in place on one of the cervical rings with only slight forward pressure on the gun. With gentle pressure on the gun, holding it in the cervix, reposition your hand with the thumb on top of the cervix and the tips of your fingers underneath. Try to work with the fingertips rather than the entire hand. Your fingertips are more sensitive, so you will better know where you are in the cervix. Also, by using your fingertips, there is less tendency to overstretch the rectum and cause lots of contractions. With continuing forward pressure on the gun, slowly flex and bend the cervix in front of the gun, working your way through the cervix. Also, move your hand directly ahead of your gun. Think of this process as rocking and rolling the cervix. Your hand holding the cervix should be doing all of the manipulating, and the only movement from your gun will be steady forward pressure. Trying to drill the gun into the cervix will rarely result in making forward progress, and almost always end in frustration for you and irritation for the cow. As you reach the anterior end of the cervix with the gun, make sure your thumb and fingers are in front so you do not burst through the opening into the uterus, causing trauma to the uterine horn with the gun. When the gun has passed all the way through the cervix, you will notice it slides smoothly into the body of the uterus. With the tip of the gun slightly forward, move your thumb and fingers back to the point at the thickest part of the cervix. This thickest point is located at the last cervical ring before the wall tapers into the uterus proper. Place the tip of the gun until the last 1/4 inch or 1/2 centimeter of the gun is in front of your fingers. In this position, you will have unobstructed flow of semen into the small channels located in the interior cervix and into the body of the uterus. A common mistake is to pinch off the uterine body in front of the gun, thus restricting the flow of semen into the uterus. A gentle touch is advised to lessen the chance of trauma to the uterus. Once the tip of your gun is in position, it is time to deposit the semen. Raise the plunger end of your insemination gun so the tip is slightly turned down to permit the semen to drip off the end. If the tip of the gun is pointing upward when you are making your semen deposit, much of the semen may run back down along the barrel and end up in the cervix, or, in extreme situations, even flow back into the vagina. Make a steady, slow deposit of the semen that lasts approximately 5 seconds. Do not shoot the semen out quickly, as this results in semen being forced back along the sides of the gun, rather than going forward into the uterus. If the cow moves while you are depositing the semen and you lose your position, then stop and gently correct your position before continuing. After depositing the semen, slowly remove the gun from the cow's reproductive tract while steadying the cervix. Pulling back rapidly may siphon some of the semen back through the cervix and into the vagina. Once the gun is removed, you can release the cervix. Check the tip of your insemination gun for any blood or abnormal discharge, which should be noted on the breeding chart. Check to make sure the tip of the sheath is intact and that no semen has flowed between the sheath and the gun. If you grasp the sheath on the gun near the handle, you can slip the sheath off the gun and then holding it in your gloved hand, remove the glove, turning it inside out over the sheath. Clean your gun and equipment before putting it away so it will be ready to use the next time you breed cows. Remember that proper artificial insemination technique is not something that is learned overnight. It takes persistence and practice. Let's review a few of the steps that will help you along the way. First, don't ever remove your hand from the cow's rectum once you have put it in. Putting your hand in and removing it repeatedly causes her rectum to fill up with air and makes the task of palpating the reproductive organs very difficult. Second, when looking for the cervix, use a sweeping motion with your hand in the rectum, pressing down to the pelvic floor. Start with your hand shallow and move progressively deeper until you find the cervix. Remember to enter the cow with your breeding gun at the proper 45-degree angle to avoid getting stuck in the bladder. When entering the cervix with the gun, picture it as fitting the cervix over the gun. Rock and roll the gun through the cervix. Do not try to force it through using pure muscle. It takes finesse. Finally, when depositing the semen, make sure to gently check your placement with your fingertip and then remove it from the end of the gun. Depositing the semen should be a slow and steady process, lasting about 5 seconds. There you have it, a look at the anatomy, techniques, and tips of artificial insemination. Please remember this video is not intended to take the place of a supervised artificial insemination training course and should not be used as such, but rather as a training aid to help further your understanding of the AI process. If you have any questions, please do not hesitate to contact your local GENEX representative. Good luck!